What is the best treatment for premature jowling? I am only 35 years old and have horrible jowls. They are getting really bad really fast. I am really self-conscious about them. I'm concerned about not looking natural if I were to have surgery. What type of treatment would you recommend?
Thank you for your question. You're 35 years old and you stated in your question and you submitted some very good photos that you have some premature jowling at the age of 35 and that you're concerned about the results of surgery. So the photos you submitted are certainly very, very helpful. It certainly does um, uh, confirm the perception of jowling that you've developed that is, yes, you're relatively young to have this type of appearance. Before talking about solutions, something for you to think about, and just as a fact, as something that may be contributing, is whether or not you've had recent medical stress or physical emotional stress. Essentially, that does accelerate the aging process. Whether or not you smoke. If there are basically things that are very toxic to your body, they will accelerate the aging process. Now, assuming that none of those things are true and those aren't factors contributing, then we get to just the genetics. If this is a genetic trait that runs in your family and that you have light skin and the skin is relatively thin and you're just getting this type of appearance, you essentially have two options. And those options still do require proper physical examination. I'll tell you that in our practice, the youngest patient we've ever done a facelift for was 37 years old. And this is somebody who's a physician who was very well aware of all the other options and did try options such as fillers and realized that her skin was just too loose. And so what we did was a conservative facelifting procedure. You see, the key to me of facelifting surgery and why so many people are so afraid of results is they always see the bad facelifts. They see the ones where people are pulled tight and their mouths are all pulled and they just look like the wind tunnel effect. But my philosophy is facelifting is really about repositioning the soft tissue of the cheeks and the jowls to where they belonged and when there is descent. So, that being said, you may be a candidate. It's basically with the physical exam, we just lift the skin and see how much room we have to move. If there isn't a lot of room, then we don't do the facelift, we wait. But if there is a lot of room and we can see a real definitive improvement, then perhaps you might be one of those rare cases of someone in your mid-30s who can benefit from a lift. Another thing you can consider is the option of camouflaging this jowl area by filling in the volume loss in the lower face, particularly in the mesolabial folds, often referred to as the marionette lines, and the mandibular notch, which is the notch in the bone that accentuates the jowl that's right behind it. We've been very successful in using a material like Radiesse, which is a deeper filler, to fill out these areas, and it does effectively camouflage, particularly in people who don't have the time to do a facelift right now, and so they plan on doing it maybe a few months from now or a year from now, and they want to do something to buy some time for important social events. So you can consider the option of fillers. So the two options are surgery, fillers, and sometimes it's surgery and fillers. A lifting procedure doesn't necessarily address all of the issues with volume shifting or volume loss. A lift can reposition the skin and volume in a way that's advantageous. But when you look at the mesolabial fold and or the marionette lines and the mandibular notch, those areas can look better with lifting, but don't always get completely improved depending on your perception and level of satisfaction. So my advice is to meet with qualified, experienced cosmetic surgeons. I think someone who knows, who does a lot of lifts and does do fillers as well, will guide you appropriately in what is right for you. And of course, you need to be aware of the incisions and whether or not that is something you're willing to accept. We, in our practice, just as a side note, what we do is we use not only, of course, very good surgical technique coming from 20 years experience, but also we use something called extracellular matrix, which is a material that's used for wound healing, and it helps make these incisions look even better. We use it in pretty much all of our facelifting surgeries, and we're very impressed by how quickly people are healing and how good their incisions look. And that's just one more tool in the toolbox that we use to try to get these results to look as good as possible so that a woman can pull her hair back and not worry about the conspicuous appearance of a scar. So I hope that was helpful. I wish you the best of luck, and thank you for your question.